For example, in radiology, we have an MRI, is 1.5 Tesla. That's one of the highest you can find here. And we also have a 64-slice CT scan. And while we have a 16-slice CT scan as a backup, and in most places will be what you get is a 16-slice CT, but we have that as a backup here because we have a 64-slice. We have all the equipment, mostly GE, and they rank amongst the best you can get anywhere in the world.
The 64-slice CT is better than the 16-slice because it has a higher resolution. Then the thickness is small. That's the main reason anyway why it has a higher resolution, so that the smallest pathology is picked in the patient. Then for the MRI too, I think the 4D that we have is very great compared to the older versions that other places have. It will give a higher resolution, just like the CT that I said earlier on. Then it's going to be very good. At least all the people that will benefit from it, we know that yes, they are getting something that is very good from Kwara State.
The Laboratory Services Department does not fare less in terms of quality equipment, which include hematology analyzer, automated coagulation analyzer, the Cobas 4000 analyzer used for serum chemistry and immune assay in the immunology laboratory, amongst others, with the ability to deliver world-class services.
We have 3 sections in the lab. One is the main lab, one is the microbiology lab, one is the PCR lab, and we have blood bank also, but it's a separate unit. In a main lab, we can do hematology, biochemistry, and RI, that is all hormonal assays. Your hepatitis A, hepatitis B, A, HIV, everything. In PCR, there is a RNA quantification, that is counting of the viruses in the blood. The patients who have hepatitis B positive and they want to see their follow through after taking the medicines, whether medicines are working properly or not. So these PCRs will help them to know that. There is one microbiology department which is totally separate. Okay, I think we have seen that one. The blood bank also, we are trying to start a component blood bank, not a normal blood bank, what is here in Nigeria. So this will be the first blood bank of their kind in Nigeria who is giving all the components. So it's not like the whole blood what we are giving to the patient. We will separate the components and as per the patient requirement, we will supply that. So this is the first time is going in Nigeria that the blood bank has with the components. So this is going to be helpful for the medicine, for all the doctors and all the patients also.
The center is also automated and customers can register for service online, receive their results in 0 downtime, while the microbiology unit has the automated culture system, modified Fitch-Rosenthal counting chamber, class 1 biological system, and polymerase chain reaction techniques and equipment. It is also important to mention that the center has a number of partner centers across the world who collaborate with it to confirm the results of tests and diagnosis with a view to reducing human error to the barest minimum.
The equipments what we have are all state-of-the-art equipments. It's all from Roche, okay, and all of them have a state-of-art. All are bi-directional. So everything is automated on these systems. Here the culture is doing manual things or more, but with this automation the interaction of the peoples with the samples are very less. So wherever there are human errors, that will be minimized with these systems. So the system what we are following now, once the patient get registered on the system, on the reception, the data and the tests, those are available on the system, are directly transferred to the machines. So what is our job? We have to just barcode that sample and keep it inside the machine. The machine will read the barcode and run the test. So everything is automated. Wherever there are human errors are minimized. So that's how we are going to work out.
I can tell you, with the type of equipment we have, there are some equipment that on their own can do 100 different investigations. 100 different investigations. But altogether, I think we have capacity to handle not less than 3,000 medical investigations in Kwara Diagnostic Center. So we are probably going to be a major referral center. So even some of the studio outreach we talked about, because it would be better for some of them to partner with us, and that's what we call economies of scale. If they probably do not have the kind of capacity we have, and they have their own clients, they can always come to us. We will do the work for them, and it does not take anything out of them at all. In fact, it helps them. So they can also partner with us, and they don't need to reinvent the wheel, because we have a greater capacity to handle all these investigations based on our equipment listing.
The center also boasts an admixture of Nigerians and expatriates with expertise in various fields of medical diagnosis. This has subsequently attracted some of the best brains, especially indigenous experts from across the globe.
If we say we've taken the best, of course our people are very competent. We make sure they have the appropriate licenses where they should have it, and we make sure that they will deliver. They may make our service delivery, what it should be. And I should also add that apart from the local staff we have expatriate personnel in different areas. Like in radiology, we have 3 expatriate staff in our radiology. In our main lab, we have another expatriate staff who in fact is the manager of that lab.
And like all its investments on behalf of the good people of Kwara State, the Diagnostic Center will be overseen by Harmony Holdings Limited. Right from conception, the Diagnostic Center was planned to be the best of its kind. To achieve these objectives, the government of Kwara State has also gone one notch higher by hiring a management consultant to manage the establishment like a private enterprise with 5 years maintenance paid for in advance. It is no longer news that the cost of seeking diagnosis abroad, which is quite expensive and way beyond the reach of the masses, has negatively affected the health habits of Nigerians. It is thus expected that the coming of the Kwara Advanced Medical Diagnostic Center will bring a positive change in this area.